Hi, good morning, everyone. It's 8 o'clock. I'd like to call the September 12th Finance Committee meeting to order. Can we have a roll call, please?
Member Cahill. Here. Member Chaplin.
Here.
Member Childress.
Yes.
Member Colbert. Member Dessart. Member Eckhoff. Member Evans. Member Galassi. Member Garcia. Member Guston. Member Krajewski. Member LaPlante. Member Ozog. Member Rutledge. Member Schwarzy. Member Tornatori. Member Yu. Member Zay.
Okay, we have a quorum. So we're going to move right on to our presentation. And this morning we have Chris Boucher from Marsh McLennan to talk about our health insurance. Good morning, Chris. Welcome.
Good morning, and good morning to the county board. Again, my name is Chris Boucher. I am with Marsh McLennan. Our firm has the distinguished pleasure of serving as the county's employee benefits advisor. I'm just sort of scanning the room. I see some familiar faces, but I see a lot of new faces. So this may be, it's not lost on me, this may be your first time having a conversation around employee benefits. So just by way of background, what I will share is when you think about the county as an employer, employee benefits is likely the second largest spend next to payroll. It's significant. And while I am given the privilege of standing in front of this committee maybe once or twice a year to talk about the benefit program, the county does have an internal healthcare work group that meets quite regularly to talk about the program, the future year forecast, cost reduction strategies. Included on that committee is Ms. Chaplin, board member Zay, who I see conveniently is not here today. He's seen the presentation, didn't want to see it again. We also have Mr. Kottmeyer, Mr. Martinovich, and then Margaret Ewing and her human resource department. So the team got together about 3 weeks ago. We walked through 100 pages of very dense content. We're not going to do that today. We've distilled it into about 50 slides, which I will walk you through. But the plan here is to share with you the future projection for 2024. We have organized a series of cost reduction alternatives for your consideration, and we hope we'll be able to move those towards resolution.
And just before you start, Chris, I'm going to ask board members if you could please write down your questions that you have, because I'd like Chris to be able to get through the presentation, and then we can have time for questions when he's done. So thank you.
Yes, thank you so much. Okay, so we always like to start this dialogue with a walk down memory lane. This year will be no different, a history of program changes. So when I stood in front of this committee about a year ago today, I shared with the finance committee that we were projecting for 2023 a increase, you see it down in the bottom right corner, of 9.3%, roughly a $2.3 million adjustment to the employee benefit program. That includes the medical, the pharmacy, the dental, the life insurance program, all programs combined. We also brought forth, like we will later, a series of cost reduction solutions. Ultimately, the finance committee decided not to adopt any program changes for 2023. And the county absorbed the full brunt of the increase. You can see at $2.2 million, $2.25 million. Why did the county arrive at that decision? How? Well, it really wasn't induced by the results for 2023, but really the 2 years prior. This is looking at the last 3 years. Back in 2021, across all programs, the initial cost increase was $22,000, 0.1%. Program modifications were introduced that year to the tune of about $437,000. So for 2021, employee benefit program costs were projected to decrease by $415,000. You can see in 2022, a very light increase for starters at $532,000. Modifications also were introduced in 2022 to the tune of $150,000, which brought the result down to $382,000. And then I just shared with you the numbers for 2023, but all in over 3 years, the county's program costs, bottom right corner, have adjusted by 3%. That is ultimately what compelled the board not to introduce changes for 2023. So how is the plan performing? So the county operates a self-funded plan. It's a self-funded medical prescription drug and a self-funded dental plan. What that means in the case of the medical program is that we pay Blue Cross Blue Shield of Illinois to process the claims for the county. And then whatever those claims are, that becomes the county's responsibility. We could win, we could lose. We take risk as a self-funded program. So the county has two distinct medical programs. There's a HMO, which contains roughly 85% of our plan enrollment. The medical program, the PPO, has about 15%. When you look at the medical plan together, you can see year-to-date through July, the self-funded program is 10.4%, $2.1 million over budget. We'll talk about why that is in a few slides. The dental program has a favorable variance from budget, roughly $46,000. When you blend it together across both the medical and the dental, the self-funded plan, year to date, again through July, 9.6% over budget, $2.1 million. Now, there's been a lot of debate in this session in the past about the HMO versus the PPO. And we've talked about the merits of the HMO program. It's a tightly managed HMO. And for those of you who are familiar with HMOs, it basically means that you can't go see any provider you want whenever you want. That's a PPO. With an HMO, you have to have the consent of a primary care physician. So if you have you want to go see an ear, nose, throat, a cardiologist, you can do that, but first you need to get the referral from the PCP. That mechanism really helps to contain costs. Now here you're looking at this slide and you're thinking, goodness, the HMO is 14.4% over budget. The PPO is minus 2.5%. Maybe we made the wrong decision. Maybe we should be steering everybody to the PPO. But when we take those numbers and we put them into per employee per month format, and I'll just reference the numbers on the far right of the screen, you can see that the 2023 year-to-date results through July, even though the HMO is over budget and the PPO is under budget, those costs are about a 50% delta. The HMO is significantly less than the PPO. So continuing to try to steer our participants to the HMO offering is the right approach for the county. Down at the bottom of the exhibit, this shows our self-funded medical plan performance month by month by month. This is cumulative. It's not the individual month's performance, but rather the aggregate performance in a cumulative format. You can see in 2022, we wrapped up the year 4.7% over budget. 2023 year to date, we got out of the gates a little slow at 9.5%, sort of snowballed in February and March, and now we're hovering over the last few months at about a 10% variance from budget. Here is a 5.5-year review of the county's plan performance. So it dates all the way back to 2018, takes us all the way through 2023 year to date, July. You can see the trajectory headed upbound. In 2022, 2023 are really not the results that we were looking for. Again, as to why that is, do we have an issue with the coverage? Are we not working with the right vendor partners? The answer to both of those questions is no. The problem is population health. That's what we have, a population health issue. And I'm going to show you a couple of slides that speak to that specifically. And this circumstance is not unique to the county. We're seeing this for our clients across the country. It could be, I'm speculating here, a derivative of COVID. You think about 2020, everyone's sheltering in place, and therefore people forewent their routine physicals, their mammographies, their gynecological exams, their colonoscopies. Those early detection measurements are very, very important. So what we've seen in 2021 and 2022 and now continuing in 2023 is we're not seeing level 1 issues. We're seeing level 2, level 3 issues, which are simply more expensive. You're going to see that in your large claimant results as well. What we've done on this exhibit here is we've taken the gross costs from the prior slide. The gross costs are at the top of each of the bar charts, and then we've replotted them and we're comparing them to large national benchmark data, regardless of industry. So this is going to be private, public, manufacturers, schools. That's in purple, but we're also comparing the county's results, which are at the bottom in the blue or green, to large counties, which is in the fuchsia. And you can see that we've had quite a difference from the market for a number of years, and now we've intersected, which is again not the results that we're looking for. So what's driving the expense? Well, here is our HMO. These are the large claimants, folks that have had over $100,000 of paid claims through July. And you can see that there are 16 of them. That group of 16 folks represents less than 1% of the total enrolled population for the HMO, but they have accounted for nearly 19% of the spend. In fact, they've accounted for almost $2.4 million. Now, the county has stop loss protection for the self-funded plans. And what basically that is, it caps the county's risk per participant in a plan year for the HMO at $230,000. Once a participant hits $230,000 in the plan year, the risk thereafter, every dollar thereafter for the remainder of the year becomes the responsibility of Blue Cross Blue Shield. So it's insurance on top of insurance. What you'll also notice, and we've highlighted over on the right-hand side in the column labeled primary diagnosis, is the claimants that are tied to neoplasms. Neoplasms are code for cancer. And you can see that on this exhibit of the 16 individuals that are large claimants over $100,000, 4 of them have cancer. Very, very expensive. When you look at the large claimant activity, again, a group of 16, is this aberrant? Is it high? Is it low? Well, here on slide 11, we're comparing your large claimant activity. Down at the bottom, on the far right, there's 2023, 16 claimants. 2022, for a full year, we were at 29. And for 2021, we were at a full year at 26. So we're not totally off track with our large claimant total, but what we're seeing is the velocity of the large claimants is hotter. It's faster than what we've observed in the past. They got on us very, very early in the plan year, where typically we see that exposure spread out over a series of 12 months. Here's the PPO large claimant activity. Different than the HMO, the stop loss protection, the cap is set at $75,000. So once a participant hits $75,000, that risk goes over to the Blues. You'll notice that through July, we have 20 individuals with over $50,000 of paid claims. And you can see that 13 of those have already exceeded the specific deductible of $75,000. Again, same methodology as the prior HMO large claimant slide. We've highlighted in blue those diagnoses on the right-hand side that are tied to neoplasms or cancer. Look at that group. That's a significant component of the population. This group of 20 individuals represents less than 6% of the total PPO enrollment, and they're accounting for 43% of the spend. By the way, these numbers are not unusual. They're shocking, but they're not unusual. What we typically see for employers the size of the county is it's going to be anywhere from 3 to 5% of the total participants that are going to be responsible for anywhere from 35 to 50% of the spend. It's just the nature of the health plan. And again, is the large claimant activity higher than typical? Year to date through July, down in the bottom right corner, we're at 20. We had 28, in all of 2022 and 26 in 2021. So it's not completely out of line with the large claimant penetration that we've observed in the past, but it is running hotter than what we've observed over this 2-year period. So what's going on? Okay, so here's a report that we secured from the Blues. We have tried to simplify it for your viewing pleasure. You can see we are comparing on the left-hand side the HMO, the plan performance per employee per month of certain cost categories, circulatory, musculoskeletal, there's neoplasms again. We're comparing the 6-month period, January through June of 2022, to the 6-month period, January through June of 2023. You don't need to look at the financial numbers, just look at the percentages. You'll notice for the HMO, costs are up between the 2 6-month periods in almost every single cost category. And they are significantly up in the areas of neoplasms and in circulatory. So that's going to be a lot of heart attacks. If you look over at the PPO, the results look very different. The costs are trending downward, but look at neoplasms up 273%. And it speaks to that speculation that I have around early detection not happening, and now we're catching things at a stage 1, a stage 2, stage 3, a very expensive time in the healthcare life cycle. So you see the PPO cost driving down, you're thinking, oh my gosh, once again, maybe the PPO is the way for the county. But now look at the financial numbers and compare from right to left, how those HMO dollars per employee or per member per month stack up against the HMO. They are, even though they're trending downwards, they are still significantly higher. But there's a deeper story here, and it has to do with the pharmacy program. So when you look at the HMO or the PPO, HMO on the left, the PPO to its right, again, we're doing this six-month comparison, 2022 versus 2023. Are the number of pharmacy members or participants up? Not really. Are the total prescriptions filled up? Not necessarily. The paid dollars are up, however, 24%, and the average cost per script is up north of 20%. What's going on? I'm in the middle of the exhibit now. Is it that they're not using the formulary? So the formulary, those are the medications that are covered. Is it they're not using the formulary? No, looks like we've got pretty high compliance. Are they not using generics and using more brand name drugs? Well, it doesn't look like that moved from the two 6-month periods. Are they not using the mail order? And in fact, having more drugs prescribed at the retail environment? No, that's not the answer either. The answer is specialty medications. You can see, even though the specialty medications on the HMO between the two 6-month periods only increased slightly, it's up 30%. The total prescriptions filled, again, up 28%. Most importantly, the total specialty spend up almost 33% for the HMO and over 41% for the PPO. What's going on? Why are we having so many of these specialty medications dispensed for our population? That's a great question. I'm glad you asked. Here's the answer on slide 16. It's very difficult, probably even unreadable for you. I certainly can't see it from here. But what we've done is we've coded in yellow cancer-specific medications. And if you just kind of follow that yellow over to its left column and look at the average cost per script, you'll see that these are hyper expensive medications. This is per fill. So we've got medications in excess of $18,000 per fill. And this is not a one-time fill. This is a monthly fill. And so now I'm going to connect the dots. We have more neoplasms, more cancer in the population. Therefore, folks are using more oncology medications. And it just so happens that these oncology medications are very, very expensive. And ultimately, it's having an unfavorable impact on the performance of the health plan. So as we look into our crystal ball, what are we projecting for 2024? Well, we are looking at the county's program costs across all the programs, whether it be the medical pharmacy, the dental, the vision program, life insurance, total employer spend going from 26.8 million to 30.6 million. That's an adjustment of $3.8 million or 14.4%. That assumes that we do nothing. We don't make any program modifications. We don't change what the employees pay to participate in the health plan. We literally just roll the ball forward into the future plan year. How do we arrive at those numbers? I won't get into the specifics, but we do the underwriting at Marsh. We look at 24 months of claims. So we use history to project our future. So we are using claims in our underwriting from August 2021 through July of 2023. We trend the claims into the future because we know the cost of healthcare goes up each and every year. We apply a trend factor of 5.7% for the medical, pharmacy at 8.4%. We have to include the fixed cost adjustments from Blue Cross Blue Shield to process the claims, very slight. The stop loss fee adjustments, kind of circle that one in your book because we're going to come back to that in just a little bit. The stop loss fee adjusting by almost 19% for the HMO, nearly 35% for the HMO, or excuse me, for the PPO. And when you blend the two together, or blend all the numbers together, you can see we're projecting a 13% increase for the HMO and an 8.2% adjustment for the PPO. Dental, we're actually projecting a decrease of 2.5%. From the rest of the programs, really much to do about nothing. The vision program, we are fully insured with Superior. We're up for renewal, and they provided a renewal offer of minus 4.1%. The life and disability program with the Hartford is 2024 represents year 2 of a 3-year rate guarantee. So no changes to that pricing. And then we assume relative to the spousal and the tobacco surcharge programs that are currently in place, and also the current opt-out bonus, that those programs will not be modified. Here's the history. Again, 24 months of claims. Here it is for the HMO. A lot of numbers here. We have the enrollment per month, by month. On the left-hand side, we have all of the paid dollars, medical separate from pharmacy. We net out any stop loss reimbursements that we received in that month. We get a net paid, and then we take that net paid amount and we divide it by the total enrollment to get the net paid per employee per month on the far right-hand side. And then what we've done is we've identified the worst 10 months per employee per month. And what do you notice here with the HMO? You notice that 5 of the worst 9 months have been within the last 6. So the plan performance is deteriorating on the HMO. For the PPO, a bit of a different story. In 24 months of claims, same exercise. When you look at the worst 10 months on the right-hand side of the page, you'll notice that most of the unfavorable experience is in the rear view mirror. And we've had better results here in 2023. This is simply an accounting. This is a ledger format of the projection that I just shared with you. We have each line of coverage broken out by the total or the gross cost, the county's share of the cost, and then the employee's portion of the cost. We aggregate at the bottom. We're comparing the first financial column, which is the 2023 budget, to the projection for 2024. Again, absent of program changes across all the programs, it's a 14.4%, $3.8 million increase. All right, let's start trimming away at this. So I talked about the stop loss protection with the blues. So the HMO has a specific deductible of $230,000. The PPO has a attachment point of $75,000. We go through the renewal process with the blues, and one of the things that we look at is the plan performance history, which is on slide 26. And so a lot of numbers here on the slide, but let's just reference 2019. So it's telling you who was the administrator, Blue Cross Blue Shield, what lines of coverage were included, both the medical and the pharmacy. This is for the HMO, what the specific deductible was for that year, $230,000, how many participants were enrolled, what we were charged per employee per month for that stop loss protection, and then we get the total cost for the year, $764,000. Now at the bottom, we say, hey, how many folks exceeded the specific deductible? And in 2019, there were 3 of them, and we received reimbursements totaling $289,000. And then we net the 2 out. How much did we pay? How much did they give us back? And you can see that we ran a loss ratio in 2019 of 37.8%, which means that for every dollar we paid the blues in stop loss premium, they gave us 38 cents back in reimbursements. Across this 4.5-year review, you can see our loss ratio is roughly 67%. Here's the PPO plan. I'll point out a couple of numbers here. 2020 and 2021, if you look all the way at the bottom, you can see that in those 2 years, the blues actually lost money. So you paid them less than they paid you back in stop loss reimbursements. And over this 4.5-year review period, the loss ratio was at 92%. So that means that for every dollar you gave them for PPO stop loss protection, they gave you back 92 cents. That's a pretty good deal for the county to have that kind of protection. But we go through the renewal process. And when you think about like the PPO loss ratio specifically, it's highly likely that the blues were going to give us a pretty substantial increase, and they did. I mentioned it earlier, the PPO bottom right corner, a 35% increase to the stop loss premium. If you go up a few cells, you'll remember that the HMO stop loss is increasing by 19%, the cost for the programs. Now, typically, the blues, when we're going through the renewal process, don't give us the option to modify our what we call specific deductible, which is the $230,000 for the HMO, the $75,000 for the PPO. They don't give us that option. But this year they did. They gave us some options, and we find them intriguing. I think you will too, as intriguing as it can be when we're talking about employee benefits. So what we do in the simplest terms is we look at 4.5 years of history. We, again, just like our underwriting, we trend the claims into the future, and we try to determine at each of the price points based on the exposure at the different deductible levels, what's the best buy for the county? I'll make a long story short here. This is the HMO on slide 30. What it's telling us, our analysis is that up on the top right-hand corner, it's telling us that over 4.5 years reviewed, it's in the county's best interest to push our deductible from $230,000 to $275,000. So the way that that works is it means that we're going to be taking on more exposure per participant, right? The county's risk goes from the first $230,000 to the first $275,000. But what changes, the trade-off is the cost for the insurance is less. So based on the numbers, it's telling us that $275,000 is the best buy. But what we do is we take the pricing at each of the spec levels, 230, 250, 275, and 300, and we run them through our underwriting tool to get the answer as to which is the best buy. And what it's telling us, and this is the bottom row of this exhibit, is that for the HMO, if we push up to 250, if we push up to 275, or if we move up to 300,000, we're actually going to lose. Stay at 230. That's what the data is telling us. But look at the PPO. This is fascinating to me. And your laugh tells me I nailed it. So if we were to take our specific deductible for this PPO plan from $75,000 up to $125,000, you can see it itemized in yellow, the county would save roughly $2 million against the renewal premium. So the costs are going up 36% if we do nothing for the PPO. If we do nothing, the cost versus the renewal goes down 52%, $2 million. Okay, but that sounds a little risky. We're taking on more exposure for this population that we know has more higher risk participants. Down at the very bottom, we've got the historical number of claims at each of the spec levels. So for example, under 75,000 in 2021, we had 18 participants that hit $75,000. In 2022, 17. And as I shared with you earlier, 2023 year to date, there are 13. If you look at 125, in 2021, we had 9 participants that reached those types of numbers. 2022, there was also 9. In 2023 year to date, we're at 4. The most important number on this exhibit, other than the $2 million of savings, is the number of claims to break even, which is shaded in blue. You see it under the 125, 40.4%. What that means is that we would need to have 40 participants at $125,000 in order to lose on this adjustment to 125. We need to have 40 folks at 125. The most we've had over the last 3 years is 9. This isn't even close. This is a win for the county. And so when we take that pricing and drop it through our underwriting tool at 125,000, it means savings to the county versus the renewal of $1.3 million. This is a no-brainer. And it's our recommendation for 2024, one of them. Just to give you one last bit of perspective here. So this is looking at some market data among 20 employers that have the same type of size as the size that the county has within the PPO cohort. You can see that the county's at 75,000. Most of the market is setting their protection at about 150,000. So we're proposing to go up to 125. It feels a little scary. It's a big increase, but it's still less or more protection than most employers have, the same size as the PPO population. All right, so that's the first cost reduction option. We did look at some plan design adjustments. I won't step you through all of these, but the one that we're asking for the board's consideration on is to take the HMO, primary care physician or PCP copay from $20 per visit to $25 per visit. If we do that, the cost avoidance is roughly $28,000. That's the only plan design change we're recommending for the medical. For the pharmacy program, to help offset this new balance of spend on the pharmacy, we are recommending for brand name medications, not generics, but for brand name medications, we push the per fill copay up from $30 to 35 for formulary brand name medications, and the non-formulary brand name medications, moving those from 50 to 55. We do that for both the HMO and for the PPO, and you can see combined, it will generate over $40,000 of cost avoidance for the county. We're also recommending that we make an increase to the employee dental contributions. Contributions, you can see benchmark from 2022. We're having a conversation about 2024, but the benchmarks for 2022 for those who are enrolled in single coverage versus those who are enrolled in family. You compare those to where the county's at today, bottom left corner. We benchmark very, very well for single and for family. What we're proposing is to take the cost share split from 50-50 to 60-40, where the employees are paying 60% of the dental program costs. The monthly difference with that proposed change is in the bottom right corner, less than $4 a month, just over $10 a month pre-tax. Pre-tax, that's what the adjustments would be with this change. And if adopted, it would generate $174,000 of additional payroll contribution revenue for the county. Two other adjustments that we're recommending. One is for the opt-out bonus. So today we pay participants $50 per month not to enroll in our plan, not to enroll in our plan. And what we have seen over history is that we have opt-out bonuses starting at $150 a month. We get some folks who take advantage of that. The number comes down to $100 per month. The same number of participants take advantage of that. We move the number down to $50 a month. The same number of people are opting out. The reason they're opting out is not because you're paying them to do it. The reason they're opting out is because they have a better option. I don't think $600 a year is really moving the needle for folks to waive the medical plan here at the county. So we're proposing to test that theory to lower the opt-out bonus once again from $50 to $25 a month. And you can see that the savings is $127,000. We're also proposing to lift up the spousal surcharge. So today the county has a spousal surcharge. This is applicable to working spouses that have access to their own employer-sponsored coverage, and they want to be enrolled in the county's health plan. They can do that, no trouble, but they're going to pay an additional $75 per month. The concept or the theory behind the spousal surcharge is, why should we pay for somebody else's employee? That's the philosophy. Just sort of moving that ball forward, we're proposing to take that spousal surcharge from 75 to 150. You can see where the market is in the bottom or over on the right-hand side at 100. But if we do that, it'll generate $140,000 of additional surcharge revenue for the county. All right, now we're going to focus on prescription drugs, and I'm going to move through this quickly. So for our clients, a lot of the PBMs, prescription benefit managers, Express Scripts, Prime Therapeutics, CVS Caremark, OptumRx, these are the big ones. The county partners with the Blues, and they use Prime Therapeutics. These PBMs want to lock their group customers into multi-year deals. They want to take a picture in time, say, we'll give you a 3-year contract. We don't let our clients do that because the market evolves rapidly. Every year it's changing. And so the county has a 1-year contract with the Blues, and they gave us the renewal offer. We said, close, but we needed to be better. So we pushed them. This is showing the contract provisions. So we have the current contract provisions on the left. To its right is the renewal contract after we negotiated. You can see that the minimum discount has been adjusted for brand name medications at retail. It's really across the board. That's why they're all highlighted in green. So this is not something that you have to decide. This is simply keeping everything status quo and enhancing the contract provisions. And this change will generate $116,000 of savings for the county. But we also asked the Blues, specific to the PPO plan, do you have any alternative formularies? So again, the formularies that's the list of medications that are covered. And they say, yeah, we have an alternative formulary. It's called the balanced formulary. And if you were to adopt the balanced formulary, the pricing that you just saw down the middle basically carries forward, except for the rebates down at the bottom, they become enhanced. You generate another $78,000 savings, but that could be disruptive. So the formulary, we're going to take the formulary that the county has today for the PPO plan, and we're going to shrink it. Is that going to be disruptive? Are people no longer going to be able to get the scripts that they get today? Well, we tested that. And when we looked at the claims from April of 2023 through July of 2023, so a 4-month sample, you can see that only 2.2% of all medications filled for the PPO group would be disruptive. Now, the disruption comes in different forms. Some of them are, it goes from being a brand or a level 2 medication to a level 3 medication. And you can see that the pricing then changes. That's down at the bottom of the screen. Some of it is, well, we cover that particular medication, that therapy class. We just don't cover that exact medication. We cover a different version, a different manufacturer's version of that medication. And that's going to be under that pink. That's going to be the middle column. And then there are certain medications that we found that are being filled through the county's pharmacy program that can be simply purchased over the counter. And those will no longer be covered. But in total, 2.2% of disruption. And we think this makes complete sense. Just to make those 73 or 2.2% of claims real for you. Here they are. These are the drugs on the left. And on the far right-hand column is the type of disruption. Again, most of it is that there's a different version of the same medication as it has the same active ingredients, just a different label. That's where most of the disruption is going to come from. But if you were to adopt all 3 of these changes, there's one more. This is the third. So with the blues and with the pharmacy program, so they set the formulary. We just talked about that. They also set the retail network. Where can you have your script filled? And right now you pretty much have open access. So we asked them, do you have any alternative retail networks? And they said, we do. It's called our Advantage Network. And basically the only pharmacy that they don't cover is CVS. Now, Walgreens is headquartered in Illinois. They're trying to drive more activity to Walgreens. So we saw that about 20% of claims are filled at CVS. Those individuals would simply need to take their scripts. They get the same scripts, they just have to have them filled at Walgreens. That's the only difference. So we don't necessarily consider that to be terribly disruptive for the amount of savings that will generate, which is another $138,000 of the county. So if you're keeping score, the 3 pharmacy plan options that I just shared with you, the one, alternative one, which is going to happen inherently, that's our negotiating with the blues, 116,000. The tightening of the formulary for the PPO plan, another 78,000. And then moving to the Advantage Network, no CVS as of January 1, this bundle brings in another $332,000 of savings for the county. All right, so let's pull it all together. I told you at the beginning of the program, absent of program changes, we were looking at an increase of $3.8 million or 14.4%. Everything that I just shared with you, whether it be the primary care physician copay adjustment, the increases to the brand name copays for the HMO and the PPO, increasing the dental cost share to 60%, reducing that opt-out bonus to half, increasing the spousal surcharge, doubling it, that specific deductible for the PPO plan, taking it from 75 to 125. And then the 3 pharmacy options we just looked at, when you pull those all together, it generates cost avoidance for the county of almost $2.2 million. Brings our increase down to 6.4%. But we haven't talked about the medical contributions yet. Again, a lot of new faces in the room. Would you be surprised to learn that the county has only increased the employee contributions for the medical plan once over the last 5 years, and it hasn't increased over the last 2 years. That's highly unusual. For perspective, that's highly unusual. And given the current state of the state, the projection I shared with you, the question is, does that make sense for 2024? The county likes to have a distribution of costs for the medical program. 80% county, 20% county employees. We call it the 80-20 strategy, and we've been trying to target that for a number of years. You can see how we're faring against those results down at the bottom. So 20% for the employees in 2017, 2023, we're also at 20%, mission accomplished. But if we don't make any changes to the medical contributions, since costs are going up so significantly, that share is going to erode. As a matter of fact, doing nothing, you can see that the employees will be at 17.7%. We're going to be off cycle from 80-20. In order to get us back on cycle or close enough, we would propose to increase the employee contributions by 5%, which gets us to 19.5%. We round up at 5. That's going to get us back to 80-20. And if we do that, it's going to generate additional payroll contribution revenue of about $323,000. All right, well, before I share with you those numbers and what it looks like with the medical contribution adjustment, here's what the employee contributions would look like in 2023. So we got 2023 on the left. These are the monthly amounts, 2024 down the middle of the page, and then the monthly increase on the right-hand side per month pre-tax. This is what the contribution increases look like. So now we take the same numbers that you just saw down at the very bottom on slide 51. We drop in the employee contribution increase for the medical program. And now all of a sudden the result looks even better. We go from a 14.4% increase to 5.2%. We go from $3.8 million to 1.4. Anybody want to walk through the appendix? Me neither. At this point, I'll open it up for any questions if I haven't put everybody to sleep. Oh, boy. Ms. Chaplin,
Yes.
you want to help me out here?
Yes. Okay, I'm just gonna go down the row. So I'm gonna go the first row, second row, and third row. Okay, so we'll start with.
I'll try to
Member
be
Cahill.
quick. Thank you for that presentation. It was awesome. Couple things. One, is there a way to move the employees to the PPO? Is there a way to encourage that by maybe saying the 5% increase is more toward an HMO or something like that? Because
Yeah.
it seems to be a better value if we do the PPO.
It's not.
Okay,
So
sorry,
when we
I
look
missed
at
that.
so when we look at the total cost for the county, from the county's perspective, it actually costs 50% more for
Okay.
the PPO than it does for the HMO. So
Okay,
that is
forget that
not a
question.
strategy.
All
we
right.
wanna-
Second question, about preventative programs. I think maybe we at the county here need to focus on preventative programs and incentives and really try to get our employees looking more toward that.
Yeah. And many years ago, the county had an on-site biometric screening. So we're bringing in phlebotomists, asking them to participate in a blood draw. And what was happening is we were looking at the county's plan performance results and they weren't changing. They weren't
Okay.
changing. And the reason it wasn't changing is because people thought that was like their primary care visit. That was their routine physical for the
Okay.
year. So we eliminated that program back in 2020. But trying to encourage folks to visit with their PCP, highly important, and we can certainly work on communicating that during this year's open enrollment.
And then the last thing I just had is, I do support the recommendations. I personally am not, I'm in the opt-out program
Mhm.
and I would be happy to, cut that down. I am on my husband's plan, but I would support the recommendations. That's all.
Thank you.
Thank you, Member Cahill. Member Glassy.
Thank you. And I echo thank you for the wonderful presentation. I didn't realize employee benefits could be so entertaining. So I
Yeah.
appreciate that. My question is regarding the PPO loss threshold. You're recommending the 125 versus the 75.
Mhm.
When our peers are at 154
Mhm.
and the 150 level still, we're going to save another 500,000 and the break even is 34 and we're way under that at
Mhm.
6, 6 and 3. Why not recommend that?
We just thought, given the additional exposure, maybe that's something we keep our powder dry for 2025. We could certainly do that. There was a lot of discussion within the internal healthcare work group about 100, 125, 150. Well, we're not going to know the right answer until at the end of 2024, whether we made the right selection. But it was just based on risk tolerance.
Risk tolerance.
From
Okay.
going from 75 to 125 seems like a pretty big adjustment in and of itself. Do we really want to double our exposure up to 175 to 150? No, there's no right answer. There's no wrong answer because it's all speculative.
So was this a group
Yes,
formulating the 125? What was your recommendation?
I felt comfortable at 125 as well.
Okay,
I didn't want to find out at the end of next year that we were wrong, pushing all the way up to 150.
okay. I also just want to add, I support all of the recommendations. I appreciate the presentation. I would even say for the opt-out program to drop that to 0, because I do imagine anyone opting out is getting healthcare coverage elsewhere. So I don't really understand and I would even increase the if the spouse has the opportunity to get healthcare elsewhere, I think that other employees should be paying for it. But other than that, I support all of your recommendations.
Thank you.
Thank you, Member Glassy. Member Garcia?
Yes, thank you so much, Chair Chaplin, and thank you so much for the report, always entertaining, along with very informative. Couple of questions I had. There was one thing in there about behavioral health, and you said that hasn't changed
Yeah.
this year, and that's very surprising
Yeah.
to me.
A little
Explain.
misleading with the,
Okay.
because we're comparing the 2022 versus 2023 plan performance, and it shows flat, you're 100% right.
Right,
But we saw a meaningful adjustment from 2021 to 2022. So it went up,
okay.
but it stayed high. It just hasn't gone higher.
I'm just even surprised it hasn't gone higher.
Yeah.
So, because I would like to, I don't want to see it go higher, but I'm just surprised that it hasn't gone any higher. Number two question or observation is, it's just so frustrating to me that the drugs that are helping people with cancer are so high.
Mhm.
And I just wish there was a way that we could help them because, now we're going to be increasing the cost of their insurance, and they're already dealing with an issue that is so life-changing.
Yeah.
So to me, that's just so sad that we have kind of figure that out. And I'm a little concerned about cutting CVS out as a supplier because I know my husband's had a problem getting some medication anywhere else, and they're the only ones who can supply one of his medications. So cutting them out is going to be a problem. So I think we have to make sure that the flow of the prescriptions is good everywhere before we cut out one of the suppliers.
That's at a store level. And of course, that's going to be based on geography. That's not an analysis that we can necessarily support. But in concept, your point is fair. The same medications that are filled at CVS today are available for fill at Walgreens in concept. We're not changing the covered
they're not,
medication
though.
list. But in terms of if your CVS doesn't have that particular medication in stock, I can't speak intelligently to that.
Okay, otherwise, again, I'm really happy that it hasn't risen in cost for so many years. I understand there has to be a rise in costs, at some point. But again, I just wish there was a way to balance that with the high cost of prescription drugs that people are already having to deal with. So I really wish that we could find a solution for that. Thank you.
Thank you, Member Garcia. Member you?
Thank you, Madam Chair. Thank you. I'm one of the newer board members, so I appreciated this presentation quite a bit. I also have a concern with regard to the CVS pharmacy. So I was just taking a quick look and, there are over 50 CVS pharmacies in DuPage County.
Mhm.
And I know that there are certain municipalities where it's obviously, they have a CVS, but they may not have a Walgreens necessarily close by. So I am actually concerned about this. And yeah, that is probably a big concern of mine. And the second thing is this balanced formularity.
Mhm.
So it states here that a lot of these high cost drugs have these lower cost alternatives, and this is for people who are diabetic who absolutely need, their insulin or their alternatives. Also with regard to cancer and some other things. But my also concern is that these lower cost alternatives are there side effects that that they have, which is why they go for the higher cost alternatives. Is that something that you?
In theory, it is the active ingredients in the medications are exactly the same. This just has a different label on them. So it's not as though it's a lesser variety or variant of the same medication.
Mhm.
When we do the disruption analysis, we don't cover this one, but we cover that one, and they're the same.
I see.
And so hard to say as to whether or not that could be have an implication to the participant and their health.
Uh-huh.
It shouldn't. That's this wouldn't be the first adjustment of this type that we've made, and we've not heard that type of feedback.
Okay. And actually, I had one more question that I thought of. I don't think you mentioned how many people use CVS versus Walgreens. Is there?
It was 20%. So when we looked
20%
over the
use.
last 4 months,
So
20% of the population are
That's a
using
large
CVS.
chunk of our employees
Yeah.
use CVS. Okay, thank you.
I don't know. Okay, I'm gonna go. Go Patty, go Patty. I think it was slide 3. Is that in this packet, the one where the COVID years are kind of put into the system? Is that in here?
Is it where it looks over a year-over-year plan
Yeah,
performance?
and then how it changed,
Yes.
during COVID, people weren't going to
Ye-
the doctor.
W-
And then it tripped up after because they weren't doing the pre-testing for
We didn't
different
have
ailments.
that particular exhibit in this presentation.
Okay, can you make sure that I get a copy of
Yes.
that then? That would be great. And then online RX fillers like Good RX, I've used them before. They're
Yes.
much cheaper than CVS, much cheaper than Walgreens. Is that anything that you guys are considering in the future, just to educate the employees that, you know, there is a cheaper way to do this? If that product is available, as you said, they are all the same. Has that come up in any of
It
the
has.
conversation?
Come up in the past. When you think about Good RX, these are not programs that can necessarily be tied to an employer-sponsored health plan, so we wouldn't be able to sponsor. We could promote it,
Mhm.
and we could certainly do that, but we can't speak to whether or not the program would be more beneficial for the participant versus the county plan either. So we don't want to put out false advertising. We could certainly promote it as an option or a consideration.
Yeah,
during open enrollment.
I think having options for the employees is important. And that might, you know, be one of them to help with cost also for the employees. I do know my husband works for the federal government, and the cost of insurance goes up every year. Like, they just pass it down to the employee. There is no, we're going to absorb more. It just happens. So, you know, I don't like it as somebody who is, you know, a participant in it, but I understand that the cost is the cost, and somehow it has to be absorbed. Not happy with pharmaceutical prices as high as they are, but you know, that's for a bigger board than us in Washington. I also do agree, though, the $0 on the spouse plan thing. I don't think anybody should be benefiting from it. If you have a spouse that has insurance and their insurance is what you want, then you shouldn't be getting anything from the county. So I would be in agreement with that also. And otherwise, I have sat through so many benefit plan
So sorry.
presentations
Yeah.
in my career, and I have got to say, thank you. You cut
Oh,
it away.
wow. Yeah. Thank you.
Oh, I'm sorry. Member LaPlante, did you have a question? Member Evans?
Thank you, Madam Chair, and thank you for this presentation. I have a question about PPOs and a comment about HMOs, or the HMO. So for my question for the PPOs, is there a reason why we have two PPOs?
Mhm.
And would it, I mean, it's too late for this year, but maybe for next year, would it save us any money to have just one PPO option?
It would not. So the origin of the second PPO option, the Blue Choice, was we were trying to find a way to lower the price point on the PPO. So what makes that plan different than the PPO one is it has a narrower network. It's still a PPO. They can go in and out of network. They can't do that in the HMO, but the provider network is even narrower. Whereas the PPO one, they've got access to Blue Cross Blue Shield's national PPO network. So
Okay.
that's the difference, which allows us to make the price point just a little bit less.
Okay, so I just have one comment about so it's the Blue Choice PPO.
Mhm.
I think that's a PPO I had several years ago, and I had an emergency here at work. So I went to CDH, and that was out of network. So it's weird that if you're a county employee and you need to go to the hospital, it was not considered in network. And I had to go through a lot of paperwork to try to get that covered. So at the very least, I think that hospital, sorry, what's that? Yeah. At the very least, I think the hospital that's closest to this employer should be in that
Well,
program.
happy. And when was that? And I think it's-
That was 2016. I
All
think.
right, well, I probably passed the statute of limitations, but we could have helped you adjudicate that because any emergency will be processed at an in-network benefit level, regardless of whether the provider's in or out of network.
I did get it solved through the state, but
Oh,
it was
okay.
still very difficult. And I just figured
Okay.
that there's other people that need to go to that hospital. So thank you for that. And then for the HMO, I just want to make a comment that it's really difficult to use. I got a piece of paper in the mail assigning a primary care physician to me. I don't even know where that piece of paper is. And then it's very difficult to find the login and to log in and create an account. So I think it might prevent people from actually getting the care they need because it's such a pain. So if someone can just look into that process, it might get people more into the preventative care situation versus, waiting till it's a little too late and they're paying for level 2 services. Thank you.
Thank you.
Thank you, Member Evans. Member Ozak, did you have any questions? Member Rutledge?
There we go. Thanks for your presentation. Thank you. So the first thing I have to say is I'm chairman of the environmental committee and double-sided.
Yeah,
please.
we won't bring the double-sided, we'll go without the color and we won't bring the appendix.
I don't mind the color,
Yeah.
but double-sided.
You should have seen me carrying it in here. My goodness.
Killing trees.
Yeah.
And we've done a good job of that at the county, saved us a lot of money. So anyway, so the health improvement incentives, can we do something beyond urging people just to visit their doctor? I think that there's so much more we can do from, health perspectives, eat less carbs, exercise more. I think that a program like that will help drive our costs down, particularly on some of those high dollar illnesses. Sorry, I've got scribbled all over. As far as, do you guys put a number to our aging workforce? I don't know if that's the right term, but we're seeing costs go up. Is that because our workforce is getting older?
Yeah, well, it's a component of inflationary trend. I won't give you the textbook definition, but inflationary trend. Why do healthcare costs go up every year? One, everybody's 1 year older. That's certainly a factor, but also there's new innovations in the marketplace. They're more efficient, they're more effective, but they're also more expensive. And then just general inflation certainly works its way into the health plan sector as
Just
well.
curious, not much we can do about
Yeah,
that.
yeah.
And then I'm okay with all of your suggestions except for dental.
Mhm.
Dental insurance is already pretty crappy. And I think that keeps people from seeking that kind of care. And there's too much information out there that your mouth and the health of your mouth is systemic through the rest of your body. So if our healthcare costs for people with heart issues are really a drag on our policies, then I think to get that $174 million or 174,000 out of that is stepping over a dollar to pick up a dime, in my opinion. So I would prefer to see that 50-50. And I think it's ludicrous that we don't treat that as we do medical issues. So I think that's it for my comments. Thank you.
Thank you, Member Rutledge. Member Childers, Member Dessart.
Thank you. Chris, I always enjoy your presentations. Thank you so much
Appreciate your sense
for
of humor.
distilling difficult information down to really relatable. I want to say I'm not a fan of HMO because you have to go see your doctor and pay your doctor fee in order to go to somebody. Like if I knew I needed an ENT, I would still have to pay to go see my doctor to get that referral. So I'm not a fan of that. I've got a couple of notes like Member Rutledge written all over my sheet as well. And one is, something you don't know is that we have spent millions of dollars adjusting our employees' salaries to keep up with inflation, groceries, gas, all of that. And I think that we have done a lot of creative ways in which to make our employees happy. So I kind of tried to follow through your math where our expenses would be $3.8 million increase, which is a 14.4% increase. And then I did all the subtractions and I'm only coming up with a little over $1 million in increases. So, because we're in this time we are and trying to keep employees happy, I would like to see the county just pay outright this $1 million and not put the burden on our employees at this time. That's just my opinion, but I think now is not the time to increase our employees' insurance burdens. Thank you.
Thank you, Member Dessart. Member Tornatori.
Thank you, Chair. Thanks for the presentation. Simple question. What's the definition of spouse?
Spouse, it's broad, but basically you have to be married.
By civil unions, we talk, because these things obviously are going to come up. I don't mean to get
Yeah.
into weeds, but.
Yeah, I mean, when you,
Sorry.
and now that, any individuals can be married, regardless of their orientation.
So
Spouse is
by
spouse.
Illinois definition.
Yeah,
I would presume is that.
presume, yeah.
Okay. The question on the opt-out, if your spouse is covered, the opt out by the county, it's the county employee's choice to opt out their spouse per se. So whether the spouse's insurance is good, bad, or otherwise is a family decision that they make, presumably.
Mhm.
I assume.
Yep.
Is there any? Do any of our employees get penalized if their spouse has a terrible plan? And what I don't want to see is our employees hurt because their spouse is working part-time with a less than good employee plan, and somehow or another that affects them.
So you're speaking to the spousal surcharge increase
Yeah,
from 75 to
exactly. And I
150.
agree with member Classy. I don't think $25 or $50 is going to make a difference.
Mhm.
It's going to be a decision on whether the plan is good or bad. So I guess the question isn't relevant if the employee makes the decision here, regardless of the opt-out surcharge. If my wife has got a better plan,
Mhm.
she presumably would want to be covered there. But well, the other question, I guess, is who makes that decision? I'm not a doctor. I'm not
Mhm.
a medical person. I don't know what plan is better or worse necessarily unless I do a lot of digging.
Yeah, well, you're 100% right. It's a decision at a family level. And so, at one point in time, my wife and I both worked. We both had access to programs, and every year we would get together and say, all right, which one's best for us? We're looking at the plan designs. We're looking at the price points. Of course, I know a few things about this, and we'd make a decision. And that's what every family that has a working spouse that has access to their own employer sponsored coverage will need to do. And that's what they do today. Which plan is best for us, the county or employer B? And
I should probably know this after 10 years on the board, but if the spouse who doesn't work here has got a better plan than the spouse who works here has a plan, does the employee who works here who opts out get any benefit?
Yeah.
yes, they do. That's the opt-out bonus.
Yes.
Yeah,
But there's money that comes to
yeah,
that.
$600
It's
a
not
year.
the same opt-out we were talking about with the $25 or $50.
That is the one.
Yeah.
Yeah. So there's two elements, and
So what do I get if my wife's, in theory, if I was working here and was covered and my wife's got a better plan and her plan covers me, and I tell the county, save your money with me, what do I get out of it?
$600 a year, $50
That's
per month.
$600.
Yep.
Okay. All right.
Yep.
Thanks.
Could I just ask a question real quick too, kind of following up on Sam, member Troy's question? So if we have a spouse that has their own insurance, could ours be secondary then?
It could be. Yeah, I mean, it would be called concurrent coverage. So you can be covered by two health plans, but given the pricing, I mean, think about what the employee contributions are here at the county, and then you got to pay those same contributions, presumably at employer B. It becomes cost prohibitive
Okay,
for the participants to do that,
okay,
especially with the generosity of the county's
Yeah.
plan.
okay.
Really
I
not
just-
getting much bang for the buck.
Okay, thank you.
Thank you.
Okay, member Eckhoff, any questions?
Thank you. On slide 27, we've got a listing of the average enrollment of the PPO plans. And it goes from 252 in 2019 to 336 you expect this year. Is that correct?
Actually, can we put the presentation back up? If you please? And you said, Mr. Eckhoff, that was 26.
27. That's me. The camera off them. Page 27. Anyway, it goes from 252 to 336. That's the actual number of PPOs. See it?
One more.
Nope, that's it.
Oh,
Yeah.
20, oh, I'm sorry, 27. Oh, so,
Is that the actual number of participants?
yes, that's correct.
Because every year we talk about driving people from PPO to HMO, and obviously it's gone up by about a third. We're doing a lousy job. So what do we need to do to make it work?
Yeah, it's difficult, and we try to communicate the merits and the value of the HMO. Again, think about the distinguishing factor between the two offerings. You've got an HMO, it's a narrower network. The care has to be coordinated by a primary care physician. The PPO, you see who you want, when you want.
Right. But
Yeah,
I
it's open
thought at
access.
some point in the distant past, we talked about raising the premium for the PPO more,
Yeah,
and that would do it. And obviously, either we haven't raised it or it hasn't done it. So
Yeah.
if it's gone up by a third in just 4 years, we need to do something to, I guess,
yeah.
change it.
It's a great point. And when you think about, and we haven't increased contributions in the last 2 years. This is the option that we proposed, 5%. And what that's going to do, because it's the HMO, it's 5% of a smaller number, PPO, 5% of a larger number. It's going to create a larger gulf between the price points of the two options.
How much? I mean, it's not that
Um,
much to begin with.
Yeah, I mean, just visually here, if you look at the HMO for single coverage, it's $132 a month under this option. PPO one, more than double at $289.
Yeah, but it's not working.
It's not working.
So we need to either do something else or forget about it.
Well,
So-
we did talk in our working group. A lot of it is people that are getting older because our population at the county, our employees are growing older and they're having more health issues. So they transfer from the HMO to the PPO. And we've had some, as you guys can see, we've had some serious illnesses over the last couple of years. And a lot of those people transferred from the HMO to the PPO. If I'm correct on that a little bit?
Yes, yeah, no,
Yes.
you are. You're
Well, the one
100%
thing I
correct.
remember in
Thank
the
you.
past is the DuPage County as compared to the Forest Preserve has got an older class of employees than other
Mhm.
agencies. So we're always going to expect that to be the case. So I think we need to decide either we're going to do something about it and fix it or just forget about it.
Yeah.
But just not that we have to decide now. And then you talked about claims going up because of COVID and everything. People
Mhm.
won't go into their doctor. Now that I'm hoping it's over, wouldn't we expect people to start going more regularly to their doctor so the claims will start going down?
That is the hope. So what we're seeing now is the absence of care during the COVID years, the absence of the preventive, the early detection. And so now things are emerging. You saw the neoplasms. The hope is that we're going to level off
front of
now
those
and
things.
go down.
Right, and then my last question is, we're talking about 5% increase. How does our actual contribution compare to the private sector and how does our increase compare to the private sector?
Yeah, a 5% increase. What we've observed from our private sector clients is they're increasing employee contributions because, like the county, for a number of years, due largely to COVID, they were trying to hold the line as best they could. But with costs accelerating at 10, 11%, they said we can no longer support that. So a 5% increase for private sector employers is pretty much comparable to what we're.
Is our existing or future premium about the same too?
The contributions for the county on the PPO are actually higher than private sector market results. And for the HMO, they're lower.
I'm just, I guess, next year, if I'm here and you're here, I'm gonna look at the PPO number again and say either we did something to drive it one way, or let's just stop talking about it because we're not doing a very good job. So, thank you.
Thank you, Member Eckhoff. Member Krajewski?
Thank you. Thank you for the presentation. And I know the cost of drugs are what's going up substantially
Yeah.
right now, and the whole market with the rebates from the manufacturers to the blue. I raised the issue maybe 6 years ago about looking at a carve-out plan.
I remember.
And yeah, and then they didn't do it. And the next year, I think they got a bigger rebate back from Blue Cross. Fast forward now, I mean, I think 80+% of the Fortune 500s have carve-out plans, and smaller and mid-sized companies now are going there.
Mhm.
I know Blue says they won't let you carve out, but when push comes to shove, I know in Illinois here, they do give bigger rebates back.
Mhm.
Maybe too late for this year, but maybe we look at what the costs are, an alternative to a carve-out plan. Or I think that's more leverage for Blue Cross to come back with more rebates. I
Yeah.
know I saw your 3 slides on the plans and you mentioned one, you got a little more rebate back from
Mhm.
Blue Cross for their plan,
Yeah.
but the threat of leaving and carving out is probably going to get more money back from Blue. And I don't
Yeah.
know if you can even do that this year, but I had a meeting with the chairwoman last Tuesday and I asked about that. It sounds like we didn't look at it for this year,
Mhm.
but maybe next year we could look at a carve out plan.
Yeah.
And-
So just to give the folks a little color as to what that is. So again, today, the medical and the prescription drugs are both managed by Blue Cross Blue Shield. And the carve out would be simply exiting our relationship with the Blues for the pharmacy and putting the pharmacy component with a standalone PBM, a distinct relationship from the medical. The Blues will not permit you to do that with an HMO. And the reason they won't permit you to do that is because the HMO doctors, they are very familiar with the formulary. First off, it's a very tightly managed formulary, but they're familiar with it. And so how would an HMO doctor coordinating all the care prescribe against a formulary that they don't know? That's why they don't permit us to do that. On the PPO, there is generally opportunity, but you have to have over 500 participants to carve out. I don't make the rules, but that's the Blue Cross Blue Shield rules. And we just saw we're at about 350. Now, we did do a pharmacy market review at the time that you brought this up. I think it was about 6 or 7 years ago. And what we found is that when we compared the pricing arrangements, stated material, and we're happy to go through the exercise again. When we looked at the performance of the pharmacy program with the Blues and Prime Therapeutics and compared those to carve out opportunities with Express Scripts, CVS Caremark, and Optum RX, we were getting a better arrangement at the time. We can go through that exercise if it would be helpful.
And in the carve out, you get 100% of the rebates back then?
We get 100% of the rebates as well.
Right.
It's a full pass-through arrangement.
Yeah, but not with Blue.
No, we do. That is the arrangement today. It's a full pass-through, not a spread arrangement, which is what you're detailing.
Okay, thank you. Is that all, Member Krajewski?
Yeah, that's all I have.
Okay, Member Schwartz, any questions? Okay, great, thank you. All right, we're gonna do two quick, because I want to end this at 9:15 because we have executive session and everything. So 2 more quick questions, Member Ozag and then Member Glassy. Go ahead, Member Ozag.
Thank you, Madam Chair. Thank you. Thank you for the presentation. I want to concur with Member Desart in terms of what we've been trying to do in terms of salaries, et cetera. But I think we do need to start passing on some of these costs. But considering our general financial health at this time, perhaps we could look at a 2.5% increase instead of a full 5% increase on what we're looking for the employees to do, especially considering general inflation, et cetera, right now. The other thing that we could possibly do is be perhaps more proactive, maybe send a birthday announcement or birthday reminder that people, they utilize the Affordable Care Act provisions to make sure that they know that their health, their yearly physical is covered and that they know their mammograms are covered and other provisions so that they at least get in to do that primary care, which may have been missing from their routine in 2020. So if we can do something more in being proactive about that, but I would like to look at perhaps a 2.5% and that we eat those costs this year. We do have to, I think we do have to raise it somewhat because eventually it's going to be, we may end up with a 8% increase if we don't do it gradually, because it is unfortunately a fact of life. Thank you.
Thank you, Member Ozag and Member Glassy. Go ahead.
I just, here he is. I
didn't even see us
I
up
said
there.
that that's a CFO question. I was like, Jeff, you say yes or no to that. But I did want to just, and I like to think that when we send out those emails that the board members get them as well, but the Blues does a very good job. So does Health Advocate, so does our teledoc. We, and Health Advocate, we literally monthly, like when it's, breast cancer awareness month, when it's mental health awareness month, sometimes I feel like it's a little bit too much, but we do send. There's probably not a month that goes by that you're not getting some newsletter from our vendors. Blue Cross Blue Shield has, you get discounts for their gymnasiums and their wellness programs. So we do inundate people with correspondence and newsletters. We post them on our internet, but we do send them. So people always know each month to go get your checkup. And it's, it's flu season now. So we just sent out something about flu shots. So we do try to keep that in everybody's face because we know people are busy. We do. I just wanted to say that.
Thank you, Margaret. Jeff, did you want to make some comments?
Just quickly, one of the goals of the plan is to keep an 80% county pay and 20% employee pay. So we look at all of these changes to try to get there. With all these changes now, we're at an employee cost share of 19.5%. So one of the things that I've heard is there might not be a lot of support anymore for a spousal opt-out. We've only decreased it. We haven't eliminated it. Completely eliminating that would save a substantial amount of money. And it may give us more flexibility to get to that 20% without having to raise other areas that some of the board members have concerns with.
Okay, member Glassy, then member Tornatori with it. Okay,
I would like to reiterate that I fully support eliminating that. I don't think it's gonna impact many people. And I think if they're opting out regardless of that $25 a month. But I did want to come back to the employee share portion. You mentioned that this is an industry standard, correct? So would you say nearly 100% of your other employees are passing along these costs?
They are, and it's not every year, but certainly there's a level of consistency with the increases, because the concern is that you set an expectation that we're not increasing our contributions, and therefore when it comes time to make an adjustment because it's absolutely necessary, people are outraged.
Right.
So it's conditioning.
Yeah, that's my strong concern is if we haven't made an increase since 2017, you said. And now this plan is getting thrown off to if we don't, 2020. Okay, apologize. Okay. Oh, just once since 2017. So, I mean, that is, in my opinion, setting the wrong expectation because I did actually used to audit benefit plans, which was not fun at all, but it was very, it was a consistent increase to pass along those expenses. That is an industry standard. And if we've only done it once in the past 6 years, I do think we're setting the wrong expectation. And if we don't pass that along and we're now throwing the 80-20 off to 23-17, we're going to be in a lot of trouble if we don't do the 5% this year. And then, next year it could be even more eroded. And we're just, setting ourselves up for really frustrated employees if we don't start to get back on an industry standard increase every year. So I fully support this. It is, like you said, it's an industry standard. All the tax base is going to be paying higher healthcare costs. So I think they would expect us to be prudent with their tax dollars and make sure that the county is doing the same.
thank you, member Glass. I have member Tornatori, then member Desart, and then.
I'm never in favor of taking our employees and making them less happy, if that's a good term. So I'm somewhat ambivalent about the program and the increase. What I'd like to know is, do we have a hard number of what that 5% increase would mean to an employee who's making $50,000 a year? What's that going to cost that person? Because, if it's $5 a month, it's not a big deal, but if it's $100 a month, it is.
I think it's on slide 51. Somebody help me out. 51, 52 of the presentation, where we show the 2023 contributions and then what the 2024 contributions would look like.
Yes.
With the increase. 50.
Yeah, it's
50.
it's page 50.
And then to the right, you can see
That was the one page I didn't read.
Yeah, well. Yeah, and then on the right-hand side, we're showing the adjustment by plan option, by coverage tier, employee plus spouse, et cetera.
But that doesn't include the dental increase as well. And
That's correct. That's just,
and-
that's
and the
separate.
Pharmacy increase and other things, right?
This is just looking at the medical contributions.
Sam,
Thank you.
okay, member Desart.
Yeah, I just wanted to make the point that we're not only asking for the increase in the burden to our employees to go up to 20% again from 17.5%, but we're also asking our employees to opt out, the revenue generation, the PPO savings, and not being able to go to CVS pharmacy. So we're asking a lot more of our employees than just the financial burden of the increase in the burden of insurance. And if you've been alive for 30 years, you've got a relationship with your pharmacist. And I think asking people not to be able to go to the pharmacist that they've been going to for decades is harsh. So we're not just asking for the monetary numbers, but we're also asking a lot of other things of our employees in the insurance plan. Just wanted to make that point. Thank you.
Thank you, member Desart. And this is a long conversation, but it's important, I think. So member Rutledge, because this is a huge portion of our budget. So member Rutledge, go ahead, please.
Thank you, Chair, for giving me that extra couple minutes. I just wanted to mention that I understand that we when we compare it to industry. But I just want to remind everybody, we are not private industry. We are a government entity. Our employees typically make less than the, private market. And so I think we need to limit those increases because of that.
Okay, thank you. Thank you, Member Rutledge. And with regards to, without, going to CVS, I know that I would, people can still go to Jewel-Osco and other pharmacies, but CVS will be cut out. So should we get a consensus on this? Should we, or can we come back, do you want us to take a look at do you want us to come back and maybe rework a couple numbers and?
Do we want to go to slide 51?
Yeah,
And
let's look at
just
slide.
Maybe vote at an itemized level. And I will just say, these are not easy decisions. We recognize that. There are no miracles. There are no miracles, and anybody who says, hey, we have the multi-million-dollar solution that doesn't impact employees and makes everything wonderful for employers, they're not telling you the truth. These are tough decisions, but ultimately this comes down to the county's tolerance for an increase.
I had the opportunity to be here probably in the 2010, 2011, when we did get to the 80-20 split. That was a very, very big decision by the board at that point for the 80-20 split. And I heard it throughout here that the increase that was needed to get to the 80-20 was very painful at that time because we were so far off and it took a while to get there. We spent a lot of time going through this, going through the reductions, we looked at increases up to 7-8%. And in order to keep it lower for the employees, that's what you see in front of you. And the one thing I would recommend that if we get away from the 80-20 split, if we don't increase, I'm an employee too, and nobody wants the increases, but if we get away from it, at some point, we will have to equalize it and we will have to come into line at that point. The hope is that we do have high claim activity. The hope is maybe those drop off over time and maybe our increases level out. But from what you see there is the recommendation from the working group of everybody with hours upon hours of looking at it. It does, if we don't move forward with some of these, we will have to figure out how to adjust the budget accordingly. So I just wanted to give that context, especially for the 80-20 split back in 2010.
That was kind of my point is everybody okay with eliminating that spousal reimbursement? That if you go from 25 or wherever we're at now to 0, that's a substantial amount of savings. That'll give Chris an opportunity to look at some of these comments about what you're not comfortable with and then come back with those recommendations to at least get real close to the 20% cost share still.
Is everybody comfortable with that? Okay.
So let me kind of rephrase that. So it sounds like everybody is for reducing or eliminating that $25 per, we'll reduce it. And then what we'll do is we will offset the 5% as much as we can to stay at the 80-20. And if that's the recommendation, so we will take that out and then the savings we generate from that, we will directly apply to the increase for the employees and hopefully reduce that 5% to maybe 3.1% or something, whatever we can. If that's the direction, we will go that way.
Yes, Member Cahill.
So there's two different things we're talking about. The opt-out bonus, we're saying we're eliminating the opt-out bonus. There's also the spousal surcharge.
We will.
So are you, both of those?
We would keep that in place because if we would keep that in place, we're only talking about the $25 opt-out. We will, by eliminating it, taking it down to 0, that savings would increase the amount. Chris will negotiate with the Blues, and that whatever savings will be applied to the employee contribution.
Thank you, Nick. Member Guston, one more question to.
That savings, does that get us to closer to the 80-20?
That's so what we'll do. It's not going to be the full amount, I wouldn't think, but we'll figure out once we do the marketing. And our goal will be to stick at the 80-20 because like I said, it was very, very difficult to get to the 80-20 originally. And I don't think we want to stray from the 80-20 too much.
And I agree with you because with my husband being a federal employee, they just pass that cost on to the employee. So then you're not at the end going, whoa, where did this come
Yeah,
from? You know it's coming from.
Yeah,
Thank
I will tell you, the group was very, very cognizant of not wanting to put the burden on the employees. You can see, I mean, we're absorbing almost 1.4 million to begin with. So we're trying to, and there was a lot of back and forth, but if the consensus is go with everything else, we will work that 25 down to 0. And then those savings will directly benefit the employees. That'll be the direction that we move forward in the chair's budget.
Yes, thank you. And Member Glass, you did one more comment or question?
Yeah, just one more comment. How many people were in the working group or who does that consist of?
I think Chris said it before, it's his entire team, which is a ton of people, myself, Margaret and her entire team. Jeff was in there, member Chaplin, member Zay, probably because they had the most history, they've been doing it. And then so we meet probably every month, every other month or so to go through the claim activity. And finally, the last one, I think was a 3.5 hour meeting to get to this point.
And I just, one other question for you. I mean, there was a comment made that the government, because we're a government entity, that we don't pay our employees as much, which I do understand that comment, but are you seeing other government employees that you work for raising and passing along the employee expense?
Yeah, I mean, general statement. Yeah, I mean, we're seeing increases across the board, and it's for exactly why I mentioned earlier. It's just the costs are going up. This isn't a unique situation to the county, and you know, ultimately something has to give. It doesn't make anybody feel good to pass that cost, but we have a fiduciary responsibility, and the costs have to go somewhere.
Thank you for that comment. I just want to finalize by saying, you know, you guys spent a ton of time on this. There was a lot of really, really smart, educated people in the room that specialize in this. And I really believe that we need to take your recommendations and, you know, follow through. Thank you.
Thank you, Member Glassy. And thanks everyone for the great conversation today. Thank you, Chris, for the presentation. I think we have our direction is pretty clear. So, okay, thank you. So we will move on to public comment. Do we have any public comment this morning? Okay, no public comment. I don't believe I have any remarks this morning. So can I have a motion on the approval of minutes 23-28-86 Finance Committee regular meeting minutes from August 22nd, 2023. I'm sorry, who made the motion? Member Guston, and second was Member Rutledge. Any changes, corrections to the minutes? Okay, all in favor? Opposed? The motion carries. We move on to budget transfers. Can I have a motion on 7A 23-29-89 transfer of funds from engineering architectural to and drainage infrastructure in the amount of 1.5 million to realign our ARPA 2023 budget? So I had a motion by Member Garcia, second by Member Glassy. Any discussion on this? Okay, all in favor? Any opposed? The motion carries. Can I have a motion on 23-29-94 transfer of funds from operating supplies and materials, postage charges, statutory and fiscal charges to regular salaries in the amount of 270,000 to cover regular and temp personnel costs for the county clerk? I had a motion by Member Desart, second by Member Yu. I have some questions. So I saw Member Krajewski, Member Eckhoff, Member Glassy, and Member Cahill. Member Krajewski?
Thank you, Madam Chair. I had a question for Nick or Jeff, if one of you guys come up there, but I think this is just a transfer within their own budget. So it's not coming out of our contingencies, but it's just to cover their salaries. But I know last week, the chairwoman and I met with you guys with regards to the upcoming budget. And I know one of the things you were working on with the clerk's office was you had eliminated about 619,000, I think is the number of the request. But there was a big gap between what finance thought and you were working with the clerk's office regarding on the election side. Did you guys work that out this week?
We did. We were able to sit down with the deputy clerk, go line item by line item through both of the budgets, the clerk and the elections. We were able to reduce, I think it was another maybe $600,000. And we're real comfortable with where they're at now in their 2024 budget.
Okay, well, I want to, thank the clerk's office for working with you guys and at least coming up with the, like 1.2 million now for the
Yeah.
coming year budget to make it. And since this is within our own budget right now, I think I'm comfortable with it, but I'm glad that they've stepped up and worked with you guys now. Because I mean, we even thought in that meeting that there was some money to be had there, and now that they actually gave you the detail and we're able to cut it, I'm glad they're working with you. Thanks.
I would recommend that the board approve this budget transfer.
Thank you. Member Krajewski. Member Eckhoff?
Okay, that's the same question I had, but how are we almost $250,000 off on the operating and postage? Is that because it went up really high and now it needs to come back to normal, or?
Last year, finance was heavily involved with developing that budget. I think we used some numbers from prior years, but we may have put a little bit of, I'll call it fluff in there, just to be on the safe side
All right.
in the 23 budget.
Okay, because I just don't. I mean, I appreciate what you said about you're in favor of it, and that's great. I just want to make sure there weren't like hidden places of putting money to go use at a later time. Or we weren't robbing Peter to pay Paul, so we come back in 2 months and now we have to throw in 100,000 of contingency in the postage.
I don't see that in 2024 at all. I think the clerk's office and the finance department budget team are all on the same page now.
All right, thank you.
Thank you, Member Eckhoff. Member Glassy?
Thank you, Madam Chair. That was my question, was whether or not you anticipated a request for transfer to cover the postage fee. So you don't believe that will happen?
In 2024?
Correct. No, this year. 2023.
So the budget transfer you see in front of you for 2023, the clerk went through their current budget. They figured out which lines they felt that they had money that they could transfer to cover the salary. And that's what you see in front of you. This was determined by the clerk's office. And they are confident that, unless if obviously some condition changes that they're unaware of, that they can make it through the rest of the year with what they're proposing.
Okay, thank you. And then secondly, you just mentioned that you did go line item by line item, but you said that was with the deputy clerk.
Yes.
Was the clerk present for that?
No.
Is that unusual that the actual elected official is not present for that conversation?
We've had other elected officials delegate that to their deputies.
Okay.
In some departments, yes.
Thank you, Member Glassy. Member Cahill?
Yes, thank you. That was my question too. I just wanted to make sure that this was an internal transfer and that there was no request coming forward to fulfill other obligations that they may have. So I will support that based on that. Thank you.
Okay, thank you. Any other questions? Okay, seeing none. All in favor? Any opposed? The motion carries. Can I have a motion on 23-2994 transfer of funds from account, or I'm sorry, we're going on to 23-3005 transfer of funds from account other professional services to part-time help in the amount of $10,000 to cover time personnel costs for the remainder of the year for the county clerk document storage. Can I have a motion by Member Evans, second by Member Yu? Any discussion? All those in favor? Opposed? The motion carries. Can I have a motion on 23-2988 budget transfers from 9/12/2023 various companies accounting units? I had a motion by Member Garcia, second by Member Rutledge. Any discussion? All those in favor? Opposed? The motion carries. We move on to procurement requisitions, and I'll call Member Krajewski.
Thank you, Madam Chair. Move on FICO 007-23 recommendation approval amendment of purchase order for our contract with Corvell Corp. as our third party administrator for work comp contract contract for increase by $40,000.
Have a motion by Member Krajewski, second by Member Desart. Any discussion? All those in favor? Opposed? The motion carries. Thank you, Member Krajewski. We move on to our ad hoc housing solutions. Member Tornantori. Oh, yeah, your microphone, please.
Move approval of AHR 123, a recommendation to approve a resolution to enter into a memorandum of agreement with Rounded Solutions Network in the amount of $150,000.
We have a motion by member Tornatori, second by member Desart. Any discussion? All in favor?
Aye.
Opposed? Motion carries. Thank you. And I'm going to call member Tornatori again for development.
Thank you, Madam Chair. Move approval of 232895. This is a request to direct staff to commence discussions with CMAP for a joint funding opportunity with the Department of Housing and Urban Development for application of funding of a potential $85 million grant for identification and removal of barriers to affordable housing production and preservation.
I have a motion by member Tornatori, a second by member Desart, and member Guston seeking recognition. Go ahead, member Guston.
I do have one question. HUD's budget ends September 31st, so they have no money. I mean, they accounted for it last year. How is staff looking at this as far as getting funding from HUD or CMAQ for that matter? And the $85 million appropriation on this grant funding. Is this just a pocket of money they had sitting there for a couple of years and we're dipping into it? Or is this something that's going to be under HUD's budget that CMAP for the next year? How is that all working? Because their budget ends in September.
It's a new initiative. It'll be for 2024.
And so do we know if that initiative was funded yet under their
It has
budget?
been.
It has.
Yes, that's what we understand.
Okay,
Yeah.
because they don't approve their budget till the end of September.
But it's, and also just to be clear, it's $85 million for the nation.
Sure.
So we're applying as a region
Right.
to get a portion of that.
Right.
But I
There's 8
it's
regions. too.
appropriated in the federal 2023 budget.
In the 23 budget, so there's still money in there.
Yes.
Yeah.
Okay, all right, that's what I needed to know, because their budget has to be renewed
Right.
in September of this year,
Right,
so.
right.
Just didn't know, but there's money in there, they can go after it and move on.
There's money in there and we are going for the application. Likely the grant, if we do get it, will be in for 2024.
24, of
Correct.
course. Okay, thank you.
Thank you, member Guston. Any other questions? Okay, all those in favor? Opposed? The motion carries. Thank you, member Tornatori. We move on to Human Services, member Schwarzy.
Thank you, Madam Chair. I do have a report that I need to share with this board. At our last Human Services Committee meeting, our committee approved the small human services grants for those that qualified. I wanted to share, originally, our thought process was we were going to invite those recipients to our next Human Services meeting in October, or I should say our first Human Services meeting in October. But the Assistant State's Attorney is he needs a little bit of time to get the agreements in order. So he believes he'll be able to have those done by the end of the month. And the tentative plan, don't pen this in, but pencil it in, is to have a presentation at probably the last county board meeting in October, where we invite those recipients. We'll do the coffee and donuts like we did last month. So, but more information coming. I will say that, it's certainly a wonderful program. And I know member Krajewski was a big part of getting this thing kicked off earlier this year. I guess the issues that we found was some confusion on whether or not some of these 501c3s were able to qualify. What the plan is for next year, and I really hope this board is in support of doing this again, next year, is to have the application process a little front heavy. So and we'll certainly, our Human Services Committee will certainly work with Mary Keating and our Finance Department and our State's Attorney's Department to make sure those application processes reflect better whether or not these entities qualify or not. So when it comes to our elected officials choosing those entities,
for the grants, they'll be clear cut. So just wanted to pass that out to you, that information out to you. So.
Thank you, Marcia. Can you hang on one second? I just wanted to say, anytime we do a new program, right, we're learning from it. So, sometimes you do have to make adjustments to it. So, but, it was our first stab at it, and, not a bad job for our first time. I know Member Desart and Member Krajewski, if we can just take their questions. Sure. Okay, Member Desart.
All right, thank you for that update, Chair Shorzy. And I'm sorry I missed last meeting. I was called into work for a sick colleague last minute. So, but it occurs to District 5 that we still have $43,355 left over. Is there a way to, I don't know, rejudicate seems harsh, but is there a way to give our full grant amount out, or is it a done deal for this year? And I appreciate either way. Thank you.
Can I answer?
Yeah, oh, absolutely.
So
Yes.
our Human Service Committee did approve those, a specific amount that fell within the parameters that both our finance department and our assistant state's attorney were certain that they qualified. If you want to bring something up at our next meeting, you're welcome to, and we can discuss it at our next meeting.
Okay, I appreciate that, because some of the Human Services Board members would like to give more to some of these entities that did qualify. So if we could just add on to their grants, that would be fantastic. And I'll bring it up at the next meeting. Thank you so much.
Yeah, Member Krajewski, Member Guston, and then we'll wrap it up.
Those
Mike.
have to go through full board then if they're over 25, but it's fine. We did the same thing in District 3. My question is, because we do have a lot of them, you said we're going to invite everybody here to give them out. Maybe we have each district do a little thing in their district to give it out with their different districts, since there are a lot of them, but we could actually, each district members could get together somewhere and present the check. So just a thought.
Member Guston.
Thank you, Madam Chair. Yes, and I too apologize for not being at the committee meeting. I had a death in the family, so we had a funeral that morning. However, I agree with Member Desart, and I've been talking to some of the other members on the board here to reallocate the leftover of what we have. And because there were 3 groups that were kind of in the green, not necessarily qualified, but when I talked to those organizations and got more information, they just didn't know how to fill out the application for a grant from us. And so they probably would have qualified under the legal perspective, but they just didn't know. And so, one of them was like Spaces, which is it's PACES, which is Parents for African-American Students, to help the students in many different forms. So even though they didn't qualify, when you talk to them and what they do and what they're planning to do, they do qualify. But how would our state's attorney know? They shouldn't know because they don't make those calls, but the district reps, we do. However, this year we do have excess that is left over, and would love to see it, go to like the Illinois Prairie Educational Fund, and we would do 25,000, which is a limit, without it having to come to the full board, just to kind of correct the whole situation. And unfortunately, I apologize again that I wasn't there to be able to provide that info. Thank you.
Thank you. Okay, Member Schwarzy, go ahead and complete your report.
So, this is certainly something to discuss at our next committee meeting. I just want to look, these are all great entities. We had dozens and dozens of great entities that unfortunately possibly didn't fill out the application thorough enough that may have possibly qualified. I just want to, the sticking point is if we have a discussion on some districts, entities, but other district entities, aren't choosing to discuss those. I mean, we do run into a little bit of an issue there. So I just want to make that point.
Yeah.
I'm open to discussing this, but we have to keep
And let's
that
just
in mind.
continue this in HHS because we have executive session. Go, Member Desart, one more time.
All right,
but
thank you.
this is really for
And
HHS.
Member Shorzy, my point is not to rejudicate those who qualified or didn't qualify this time. I just want to give out every dime to those who did qualify that we possibly can this term. So I'm not saying to rejudicate those who did not qualify this time. Let's just give out every dime to those who do qualify. That's it. Thank you.
Okay, thank you.
Thank you.
Please continue.
One last note before I get to my agenda item. The DuPage Care Center 56th Annual Virtual Fall Festival is going on right now. There's a table right outside this boardroom, and get your raffle tickets, order your treats. It all goes to a good cause. So thank you. And I will move on to making a motion to approve item 23, 29, 29. HSP 0029A23, amendment to the county sub grantee contract 623900001 serve issued to Teen Parent Connection through the fiscal year 23 Community Services Block Grant for the purchase of diapers, formula, car seats, and staffing time to assist low-income county residents to increase encumbrance in the amount of $10,000, resulting in a new contract total amount not to exceed $40,000, an increase of 33.33%, and this is CDBG funded.
Motion by member Sforza, second by member Guston. Any discussion? All in favor? Opposed? The motion carries. Thank you, member Schwarze. We move on to judicial public safety, member Evans.
Thank you, Madam Chair. I would like to move on JPSP 006123, recommendation for the approval of a contract purchase order to Public Safety Direct, Inc. for upfitting and repairs of Sheriff's Office vehicles and monthly maintenance for the period of October 30th, 2023 through October 29th, 2024, for a contract total amount not to exceed $522,215.
Motion by member Evans, second by member Childress. Any discussion? All those in favor? Opposed? The motion carries. Member Evans.
Thank you, Madam Chair. I'd like to move on JPSP 006223, recommendation for the approval of a contract to LDV Inc. for the purchase of an HDU response vehicle for the Sheriff's Office to provide such vehicle for safe, effective, and efficient on-scene operational needs to mitigate any potential hazards or explosive devices for contract not to exceed $838,020 per GSA contract.
I have a motion by member Evans, second by member Cahill. I have member Garcia and member you seeking recognition. Member Garcia, go ahead, please.
And thank you, Chair Chaplin. Just had a question on this. I realize this is a critical need in the Sheriff's Department, and I'm not going to be voting against it, but my concern with this, Deputy Chief Bilodeau, thank you for coming up before even being asked, is what is the plan from now forward? So this won't be a critical need. Will there be a line item in your budget where you'll be having things put aside? Because I know we've got the tablets for our next item. And it seems like we need to have something planning so that when this is a need, that you'll have money set aside in the budget to be able to pay for.
So I don't anticipate needing to replace this in any of our tenures.
No, we'll be long gone. I know, but in 25 years, somebody's going to ask, how are we going to do it?
That would be something for whoever is the bomb commander, whoever is the sheriff, whoever is the undersheriff, whoever is me, because it's not going to be me. That will be for them.
I know, I realize that, but I'm just hoping that I know we all, we're homeowners, we save for our roofs and things like that. But I just don't want to have this be coming for a board down the line when we're all long gone.
I would envision, short of a catastrophe, those people will plan for that in advance so that they don't have to go through what we've all gone through with this. Much like with the computers, remember you asked about the computers last week at JPS. The plan is going to be either a 3 or 4 year rotation so that we're not trying to do all 50 or all 80 at the same time, trying to actually get them cycled out. This is just an emergency situation where more than half of those computers, which I know is the next item, started crashing and dying, and they're continuing to do so. So that's something that we will work with to make sure that we actually get that on a rotation, not one-time purchase.
Okay, so I'm hoping in the next budget or so, we're going to see that line item saying like.
I don't know that they would allow us to piggy bank money like that for these purchases, but.
And if I can just jump in, so we had the contingency fund, and instead of putting this in their budget, staff recommended that they take it out of contingency. And that was the same with the forklift for the clerk's office. So any of these larger, big capital improvements, we would rather see in contingency than in their budgets. Am I correct on that? So that's why we're taking it from contingency and not from their budget. But I do agree that, instead of having like 18 months now where we have this vehicle that's not really reliable, maybe we should do better planning so that we have a good vehicle to use all the time and have better planning so that we're not doing it like at the last minute and rushing. But
like I said, they're industrious. They'll make through.
Okay.
Well,
yeah. So
I
thank
do
you.
believe there was another vehicle purchase that was a 2021 to help carry some of this. It was a
pickup truck. It's a pickup truck. That pickup truck, it was a F-250 pickup truck, and the trailer that truck pulls is called a TCV. It's a large, very large object that they can put explosives in to safely transport explosives. if they can do so. And we did not have a vehicle in our fleet that could pull that. Anytime we needed to pull it, we would have to go beg, borrow and steal from DOT for a plow or some other vehicle. So that vehicle pulls that, but it also pulls we can pull any one of our fleet of trailers that we have. We have quite a few trailers. So we have two pickup trucks we can use and they pull all of our trailers.
Okay, and thank you. And I'm gonna try to make this quick because I know we're running late. So when that equipment is sold, when that pickup truck is sold, does that go into the contingency plan or how does that happen? Just so
DOT sells all the fleet owned vehicles and that money, whatever they do with that, I don't know.
might be to use for something.
It probably just goes back into the vehicle fund, but that would be a question for DOT. We don't have anything to do with that.
All right, thank you so much.
Thank you, Member Garcia, for your questions. Member you.
Thank you, Madam Chair. After speaking at length with Deputy Chief Dan Bilodeau and Tim Jasper from the county's bomb unit and receiving answers to my many questions, I feel that I have sufficient information regarding this budget request now. This HDU vehicle is to serve as a command post for the bomb unit and a mobile workstation, which the bomb community is moving to in practice. I learned that officers from the bomb unit could be on a call for 4 hours on average or more with at minimum 2 techs, but sometimes during whole team activations, all 7 people from the bomb unit are present and working. And the last time this occurred was in January in Addison and last year also in Naperville during a shooting. And school threats are always considered a whole team activation. The laptops, workstations, and connections are necessary to operate 2 of our bomb robots and X-ray machine. And the LED TVs are useful to view the operations of the bomb robot and also the results of the X-ray machine. So as such, I'll be voting yes on this request today.
Thank you very much.
Thank you for all that information, Member you and Member Desart.
Thank you. I already explained why I missed committee meetings last week, but I did watch JPS and you answered questions like a rock star. So thank you for that. And actually you answered almost all of my questions. I did have one. When the board approves this today, and it sounds like it will, when do you expect delivery?
Probably about 18 months.
18 months. Okay. And also is this, I was thinking about this. Is this a highly sensitive vehicle or is this something you could take out to fairs, touch trucks to hopefully recruit kids to go into law enforcement?
My bomb team guys will scream over this question, but it is a vehicle that can go anywhere. Will we allow people to walk through that? Most likely not. The stuff that's contained inside of that vehicle, including the explosives they use to countercharge things.
All right.
Not.
Well, again, thank you
It'll
for
look pretty,
answering.
though.
Thank you for answering all the questions last week at committee. I appreciated it.
And Member Cahill.
Quick,
Thank you, Member Desart.
thank you for your presentation. I spoke with a couple police chiefs in my district and they were very much supportive of this. And they said there is nothing more frightening in the world, an active shooter and a bomb threat. And they said people freeze, community freezes when there's a bomb threat. And we need to have the resources to take care of this immediately. So they're very supportive of this. Thank you.
Thank you.
Thank you. Thank you, Member Cahill. And thank you to all of you who asked questions on this because it's important to ask questions and, to get informed. So before we make our decisions, but thank you everybody for the good questions and any further discussion on this? Okay, all in favor? Opposed? Okay, the motion carries. Member Evans.
Thank you, Madam Chair. I would like to move on JPSP 006323, recommendation for the approval of a contract purchase order to Insight Public Sector, Inc. for the purchase of tablets for patrol vehicles for the Sheriff's Office for a contract total amount not to exceed $602,805 for a cooperative purchasing agreement pricing.
Motion by Member Evans, second by Member Desart. Any discussion? All those in favor?
Aye.
Opposed? Motion carries. Thank you, Member Evans. We move on to legislative. Member Desart.
Thank you, Madam Chair. I move to approve LEG R 0038-23, a recommendation for the approval of a contract to Rouchy and Sullivan Strategies LLC to provide consulting services as lobbyists representing DuPage County before the Illinois General Assembly and State Executive Branch for the period of September 1st, 2023 through August 31st, 2024 for County Board for a contract total amount not to exceed $50,000.
I have a motion by Member Desart, a second by Member Childress. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Desart.
Thank you, Madam Chair. I move to approve LEG-R 0039-23, a recommendation for the approval of a contract to Roger C. Marquardt and Company, Inc. to provide consulting services as lobbyists representing DuPage County before the Illinois General Assembly and the State Executive Branch for the period of September 15th, 2023 through September 14th, 2024 for County Board for a contract total amount
not to exceed $90,000.
Motion by member Desart, second by member Childress. Any discussion? All those in favor?
Aye.
Opposed, the motion carries. Thank you, member Desart. We move on to Public Works and member Garcia.
I motion for approval to item FMP 007823, recommendation for the approval of a contract to Commercial Mechanical Inc. to replace existing convectors, radiative heaters in the north building, resident shower, bath, and laundry rooms, replacing existing VAV controls and replacing existing corridor linear diffuser controls at the Care Center for Facilities Management for the period of September 12th, 2023 through November 30, 2025, for a total contract amount not to exceed $407,100.
Motion by member Garcia, second by member Yu. Any discussion? All those in favor?
Aye.
Opposed, the motion carries. Member Garcia.
A motion for approval for FMP 007923, recommendation for the approval of a contract to SNI Solutions, Inc. to furnish and deliver de-icing solids, Eco Salt for facility management grounds for the period of November 1st, 2023 through October 31st, 2024, for a contract total amount not to exceed $75,000.
Motion by member Garcia, second by member Yu. Any discussion? All those in favor? Opposed, the motion carries. Member Garcia.
I happily motion for approval to FMR 000323, recommendation for the approval of an agreement between the County of DuPage, Illinois and DuPage Senior Citizens Council for a lease of space at 420 North County Farm Road, Wheaton, Illinois 60187, for facilities management for a 15-month period from October 1st, 2023 through December 31st, 2024, for an amount not to exceed $1,250.
Motion by member Garcia, second by member Desart. Any discussion? Nice work on that. Member Garcia, member Swarzy, nice, good job. All in favor?
Aye.
Opposed, motion carries. Member Garcia.
I motion for approval of PWP 004023, recommendation for the approval of a contract purchase order to Paladine Inc. to supply polymer to the Woodridge, Green Valley, and Knollwood wastewater treatment facilities for sludge dewatering and thickening for Public Works for the period of November 1st, 2023 to October 31st, 2024, for a total contract not to exceed $248,811.76.
Motion by member Garcia, second by member Yu. Any discussion? All those in favor?
Aye.
Opposed, the motion carries. Member Garcia.
A motion for approval to PWP 004123, recommendation for the approval of a contract to APG Neuros for 4 high-speed turbo blowers and 1 master control panel for the Woodridge Green Valley Treatment Plant for Wood Public Works for the period of September 12th, 2023 to August 31st, 2025, for a total contract amount not to exceed $790,000.
Motion by member Garcia, second by member Childress. Any discussion? All those in favor?
Aye.
Opposed, the motion carries. Member Garcia.
A motion for approval of PWP 004223, recommendation for the approval of a contract purchase order for Core and Main LP to deliver and furnish water meters on an as-needed basis for Public Works for the period of September 12th, 2023 to August 30, 2027, for a total contract amount not to exceed $60,000.
Motion by member Garcia, second by member Childress. Any discussion? All those in favor?
Aye.
Opposed, the motion carries. Member Garcia.
A motion for approval to PWP 004323, recommendation for the approval of contract purchase order issued to H Turbo Inc. for repair service on as-needed basis for the high-speed blowers at the Knollwood wastewater treatment facility for Public Works for the period of September 12th, 2023 to August 31st, 2027, for a total contract amount not to exceed $80,000.
Motion by member Garcia, second by member Yu. Any discussion? All those in favor?
Aye.
Opposed, the motion carries. Thank you, member Garcia. We move on to stormwater. Member Zay is not here. We don't have a vice chair here. So member Eckhoff, do you want to take that? Thank you.
He sent me an email yesterday. He's on a jet plane on a secret mission for the county fact finding. So I would move approval of stormwater AH1 SMP 64-23, recommendation for the approval of a contract issued to C Orba Group Inc. for on-call professional services from December 1, 2023 through November 30, 2024, for an amount not to exceed $65,000.
A motion by member Eckhoff, second by member Garcia. Any discussion? All in favor? Opposed, motion carries. Member Eckhoff.
Thank you, Madam Chairman. I move approval of SMR 73-23, amendment to resolution SM 397-22 for grant agreement with the city of West Chicago for Klein Road culvert replacement for an increase of $142,467.
Motion by member Eckhoff, second by member Childress. Any discussion? All those in favor? Opposed, motion carries. Member Eckhoff.
Thank you, Madam Chairman. I move approval of SMR 74-23 amendment to resolution SMR 348-22 for grant agreement with the Village of Glendale Heights for its James Court and Pearl Avenue Drainage Improvement Project.
Motion by member Eckhoff, second by member Childress. Any discussion? All those in favor? Opposed? The motion carries. Thank you, member Eckhoff. We move on to technology and member you.
Thank you, Madam Chair. I move on TEP 006323, recommendation for the approval of a contract purchase order to Carasoft Technology Group for the procurement of Zoom licensing for both the county and the courts for IT. This contract covers the period of November 5, 2023 through November 4, 2026, with $36,470.12 being paid for by the circuit court and $41,574.18 being paid for by IT, for a contract total amount of $78,044.30.
Motion by member you, second by member Desart. Any discussion? All those in favor? Opposed? The motion carries. Member you.
Thank you. And now I move on to EP 006423, recommendation for the approval of a contract purchase order to CTW Government Inc. for the purchase of warranty support and yearly cleanings for the high-speed Kodak scanners for the state's attorney and public defender's offices paid for by IT. This contract covers the period of September 15, 2023 through September 15, 2026 for a contract total amount of $33,634.
Motion by member you, second by member Garcia. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Thank you, member you. We move on to transportation. Member Ozak.
Thank you, Madam Chair. Have you started your timer?
I will.
Okay.
3
I'd like
minutes.
to combine items AJI through AJ 1, 2, and 3.
1, 2, and 3. Okay. I have a motion by member Ozak, a second by member Guston to combine items 1, 2, and 3 under transportation. All in favor?
Aye.
Okay. Opposed? Member Ozak, please proceed. The items are combined.
Thank you. These are amendments to resolutions. I move for approval of DTP 0085A21, amendment to resolution DTP 008521 issued to ESI Consultants for professional engineering services for the 2021 pavement maintenance South program to decrease the funding in the amount of $9,766.19 and close, resulting in a final county cost of $426,429.05, a decrease of 2.24%. I move for approval of DTP 0136B22, amendment to resolution DTP 0136A22, issued to Pacific Construction Services LLC for the removal and replacement of the Division of Transportation's offsite maintenance facility and an accounting adjustment. I move for approval of DTR 0173A18, amendment to resolution DTR 017318 issued to Illinois State Toll Highway Authority for roadway and bridge rehabilitation along the Veterans Memorial Tollway I-355 from Butterfield to Army Trail. Bridges increase the funding in the amount of $80,826.88. Final county cost of $329,388.36, an increase of 32.52%.
I have a motion by member Ozak, second by member Garcia. Any discussion on any of these items? Okay. All in favor?
Aye.
Opposed? Motion carries. Member Ozak.
Thank you. Next, I move to combine items 8J4 through 8J8. These are contract approvals.
Okay, I have a motion by member Ozak and a second by member Childress to combine items 8J4 through 8J8. All in favor? Opposed? Motion carries. The items are combined. Please proceed, member Ozak.
Thank you. I move for approval of DTP 009223, recommendation for the approval of contract to ML Utilities to furnish and deliver one Ford F-550 Super Cab Division of Transportation for a contract total not to exceed $236,426. I move for approval of DTP 009323, recommendation for the approval of a contract to Mackey Consultants LLC for professional surveying services upon request of the Division of Transportation. Contract total not to exceed $100,000, vetted through qualification-based selection process in compliance with Local Government Professional Services Selection Act. Move for approval of DTP 009423, recommendation for the approval of contract to Thomas Engineering Group LLC for professional surveying of services upon request of the Department of Transportation. Contract total not to exceed $100,000, professional services, qualification-based selection process. And I move for approval of let's see. Okay, DTP 009523, recommendation for the approval of contract to GSG Consultants for professional geotechnical and materials engineering services upon request of the Department of Transportation. Contract total not to exceed $200,000. And I move for approval of DTP 009623, recommendation for the approval of a contract to Sutton Ford to furnish and deliver two Ford F-550 crew cab chassis for the Department of Transportation. Contract total not to exceed $139,342.
Have a motion by member Ozog, a second by member Desart. Any discussion on any of these combined items? Okay, all in favor?
Aye.
Opposed, the motion carries. Thank you, member Ozog.
And finally, I move for approval of DTR 008023, resolution authorizing the execution of an intergovernmental agreement between the County of DuPage and the City of Wheaton for land transfers and future maintenance of the Illinois Prairie Path.
Have a motion by member Ozog, second by member Desart. Any discussion? Okay, all in favor?
Aye.
Opposed, the motion carries. Thank you, member Ozog. We move on to finance resolutions. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0195-23, recommendation to establish an agreement between the County of DuPage and the Illinois Energy Conservation Authority.
Motion by member Krajewski, second by member Guston. Any discussion? All those in favor? Opposed, motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0196-23, approval of use of ARPA funds for facilities management to make improvements to the building at 420 North County Farm Road, amount of 50,000 ARPA item.
Have a motion by member Krajewski, second by member Garcia. Any discussion? All those in favor? Opposed, motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0202-23, recommendation approval of a renewal of the intergovernmental agreement between the County of DuPage and the Village of Addison for the Addison Consolidated Dispatch Center to provide 211 service in the amount of $649,912 ARPA item.
Motion by member Krajewski, second by member Desart. Any discussion? All those in favor? Opposed, motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0197-23, approval of the new DuPage County travel expense policy.
Motion by member Krajewski, second by member Childress and member Guston seeking recognition. Go ahead, please.
Yes, a real quick question. Jason, I know I just talked to you offline over here about this, and I'm in support of it. One quick question, though, is for transparency and accountability. How can we make it so that we know that a certain department is doing this much in travel and another department is doing this much in travel, that type of thing?
Yeah,
So
and-
just for accountability.
No, not a problem. And one, I know each department has a line item for travel and they can definitely show it from a budgetary standpoint. But what we can do is we can do an internal policy through our forms and whatnot and have that annual report sent to you guys.
Perfect.
That's not a problem.
Thank you. Thank you, Madam Chair.
Thank you. Thank you, member Guston. I know this took a long time, but it was well worth the wait. We now have a new strong travel policy. So any further discussion? Okay, all those in favor? Opposed, the motion carries. Member Krajewski.
Thank you, Madam Chair. I move to combine items 9E, F, G, H, I, J, all additional appropriation, acceptance and appropriation resolution.
Okay, I have a motion to combine items E through J under finance by member Krajewski, second by member Guston, and all of those in favor? Opposed, motion carries. The items are combined. Please proceed, member
Thank you,
Krajewski.
Madam Chair. I move on FIR 0198-23, acceptance of appropriation of the Illinois State Opioid Response Criminal Justice Medication Assistance grant for 75,000. FIR 0199-23, acceptance appropriation of the Adult Redeployment Illinois Program grant for $450,515. FIR 0204-23, acceptance appropriation of additional funding for the Illinois Home Weatherization Assistance Program grant from $803,400 to $881,832,000. FIR 0200-23, additional appropriation for the Building and Zoning and Planning Fund of $2.5 million for housing solutions. FIR 0201-23, additional appropriation for the Housing Solutions Program Fund for $150,000, and FIR 0203-23, additional appropriation for the ILD CEO Community Service Block Grant, increasing from $1,115,200 to $1,328,747.
Motion by member Krajewski, second by member Garcia. Any discussion on any of these items? Okay, all in favor?
Aye.
Opposed, motion carries. Member Krajewski.
Thank you, Madam Chair. Last, I move on FIR 0205-23, acceptance of an extension of time and appropriation for the United States Treasury American Rescue Plan Act Long-Term Care Program grant for $153,000.
Have a motion by member Krajewski, second by member Galassi. Any discussion? All those in favor? Opposed, the motion carries. Member Krajewski, I'm going to call on you again for informational.
Thank you, Madam Chair. I move to receive and place on file informational items, A, payment of claims, and B, grant proposal notifications.
Have a motion by member Krajewski, second by member Yu to receive and place on file items A and B under informational. All those in favor? Opposed, the motion carries. Okay, do we have any old business? Do we have any new business? Okay, I am informed that we do have matters before us requiring us to enter into executive session. I'll ask those not associated with the executive session to please exit the room. I'll take a motion to go into executive session pursuant to Open Meetings Act 5 ILCS 122C2 collective negotiating matters. I have a motion by, who was that? Member Guston, or second by Member Krajewski. Can we have a roll call, please?
Member Cahill. Member Chaplin.
Aye.
Member Childress.
Yes.
Member Covert, Member Desart, Member Eckhoff, Member Evans.
Aye.
Member Galassi. Member Garcia. Member Gus.